welcome to the first session of our Opioid Prescribing and Overdose Prevention Learning Collaborative. I'm Christine Lamb, a Quality Improvement Advisor for Superior Health Quality Alliance, or Superior Health. And Superior Health provides support for healthcare organizations in Minnesota, Wisconsin, and Michigan under a federal grant from the Centers for Medicare and Medicaid Services. There are 6 30-minute sessions in this learning collaborative where we will introduce you to Superior Health's opioid prescribing and overdose prevention toolkit and highlight the CDC's 12 recommended prescribing practices in their updated 2022 Clinical Practice Guidelines for Prescribing Opioids for Pain. Before we get started, please add your name, organization, and role into the chat, as well as any others you may have with you today. Just so we have an idea who we have here. I'm joined by my colleague, Yvonne Burstyn, who is also a Quality Improvement Advisor at Superior Health. She will be handling questions or comments in our chat, as well as providing links to various materials throughout the session. A few housekeeping items. We will have one polling question today and a brief survey at the end of the session. If you have a question that you would like to ask verbally instead of in the chat, just raise your hand and we'll take you off mute. John Glover is our speaker. He's also one of my colleagues, and John will be introducing us to the Superior Health's Opioid Prescribing and Overdose Prevention Toolkit. And one more colleague joining us today is Dr. Dibble. John will be introducing her at the end of his presentation. John, take it away.
All right. Thanks so much, Christine. Appreciate you getting us going there. Hi, everybody. We appreciate you joining us today for our first Learning Collaborative session. My name is John Glover. I'm a licensed clinical social worker and a Quality Improvement Advisor for Superior Health. Today, we're going to look at Superior Health's Opioid Prescribing and Overdose Prevention Toolkit that we developed as an effort to combine the CDC's new 22 guideline for prescribing opioids for pain with the removal of the requirement to obtain an X waiver that came out earlier this year in order to provide medications for opioid use disorder. We thought the combination of those two things made for a particularly nice opportunity to review this information. So let's go to the next slide. So before we get started, we want to do a quick poll to get a sense of how familiar people are with the CDC's new guidelines and how they might differ from the 2016 guides that were previously published. So if we could throw the poll up, and if folks could just quickly choose the option that kind of best describes your familiarity with the 2022 guideline for us. We'll give folks just a minute to respond to that. Do we have a poll?
Christine, I'm gonna ask if you can hit the poll.
Yeah, I'm looking for it here. I know we had it ready to go, Yvonne.
No.
Perhaps people could just put it in chat for us. We've got the options there, and we'll take a look. Not at all. Not at all, somewhat. Okay. Okay. All right, that's really helpful. I appreciate you all responding in the chat. So hopefully we're going to be able to introduce you to some helpful information and kind of orient you to this and how you might use it in your facility. So appreciate that feedback for us. So let's go to the next slide. So our objectives today are simply to discuss the importance of this new CDC guideline and identify some of the important topics that it addresses. We also want to familiarize you with the toolkit that we've developed so that you can use it in supporting your work. Next slide. So we're going to start off by just taking a really big picture overview of the guidelines intentions. Next slide. So in the opening introduction, under background on page 3 of the guideline, you're going to find the CDC's rationale for publishing the 2022 guideline so soon after they had published the 2016 guideline. In summary, the opioid crisis had continued to escalate, and healthcare had been attempting to respond by putting greater limits on prescription opioids. Unfortunately, the CDC's 2016 guidelines were misinterpreted and at times misapplied, which led to additional patient harms. So on this slide, you can see a list of the various types of unintended consequences that occurred, which caused the CDC to release the 2022 guidelines. I think many of us in healthcare were aware of some of these things happening, but just, to kind of look at them, the application of the guidelines to patient populations that weren't appropriate, rapid opioid tapers, discontinuation of opioids, duration limits, even patient dismissal and abandonment. So really things that weren't best practices. And so the CDC felt like it was important to come out with an updated guideline. Next slide, please. So here's how it kind of expanded on that 2016 guideline. And I noticed there's a typo. It's interesting, no matter how many times you look at things, sometimes you have a typo. So it's not the 2023 guideline, but our 2022 guideline. So if we look at this, the 2022 guideline was an attempt to address the misapplication from the previous publication. A colleague of mine pointed out that one of the big changes was the tone of the new guideline and how it really attempted to destigmatize opioids and ensure that patients were being treated for pain appropriately, including if and when they might develop an opioid use disorder. So the new guideline specifically points out that it's not intended to be used for the purposes we saw on the last slide, and it does not replace clinical judgment or individualized patient-centered care. So you'll get this tone throughout the guideline. They really emphasize this. Also, the previous guideline focused on primary care physicians in outpatient settings, and it was clear to the CDC that there were other folks prescribing opioids that needed to be included, so they expanded the scope to include those clinicians. Additionally, the guideline promotes an integrated approach to patient care that involves collaboration, not only among clinicians, but also between clinicians and patients. Next slide, please. So one of the themes you're going to notice in the guideline is that there's a repetition of quote unquote weighing the benefits and risks of prescribing opioids for pain. Many times this is explicitly stated, but often it's also kind of implied by emphasizing the need to communicate and collaborate with the patient. A couple examples of this is how the guideline focuses more on functional goals now rather than MMEs or morphine milligram equivalents, and how it expands guidance around tapering of opioids to try to prevent some of those misapplications that we saw earlier. If you look at this weighing benefits and risks piece, you'll notice that the first 3 headings, now there's 12 recommendations and they've divided them into 4 different headings. The first 3 headings all focus on weighing benefits and risk in an implicit way. And they are determining whether or not to initiate opioids for pain, selecting and the opioids and determining dosages, and then deciding duration and conducting follow-ups. And that's all about weighing benefits and risks. Next slide, please. So another very strong message that you're going to find in the guideline is grouped under those 5 final recommendations, and they even put the heading there, assessing risks and potential harms. So really obviously looking at risk quite a bit, but in this case, we're trying to address potential harms. The idea under these last 5 recommendations really is to confront some of those misapplications we saw earlier in that slide that we covered before. So that's the last 5, and we'll go through these here in just a minute. Next slide. So let's look at the 12 recommendations. Bird's eye view, because as we said, the next 5 sessions, we're going to go into these recommendations in more detail, but I just want to give you an idea today of what they involve. Next slide. So the first 2 recommendations look at acute and chronic pain, focusing on determining whether or not to initiate opioids or utilize alternative pain management approaches. The recommendation encourages a provider to consider the use of non-opioid therapies that might be potentially as effective as opioids. And the clinicians encouraged to maximize these non-pharmacological approaches whenever it's appropriate in order to reduce reliance on opioids. Very important stuff. Additionally, they make the point that the risks and benefits need to be discussed with the patient, and this plan should be agreed upon together between the clinician and the patient. Next slide, please. So the next three recommendations are all about the selection and dosing of opioids. And so if an opioid is determined to be included in the treatment plan, then these 3 recommendations are to be considered, and that is the suggestion to use immediate release opioids over long-acting ones, and to start with the lowest effective dosage, and then to be especially careful when changing dosages, especially related to tapering. So when we decide that the risk is greater than the benefit and we may want to cut back, then we need to be very careful. And as we said, they've put in some additional guidance around tapering to make sure that's done in a safe manner to reduce harms to the patient. Next slide, please. All right, the next 2 recommendations, again, are focused on opioid use, and they explore decisions regarding the quantity of opioids and the duration to be used. The 7th recommendation also focuses on the need to reevaluate benefits and risks. That's right, you'll hear that quite a bit. Within the first 1 to 4 weeks and regularly throughout the course of care. So these recommendations focus on having the prescribers pay attention to how they're prescribing the opioids in order to reduce the harms. And I would just want to make a point here. We can all help keep an eye out for these potential harms and dangers and support each other by asking questions and sharing any concerns that you might have with the prescriber. All right, next slide, please. So the final 5 recommendations, like I said, they all fall under the heading assessing risk and addressing potential harms of opioid use. As you can see in the brief outline I've created on this slide, summarizing those final 5 recommendations, there are several mitigation approaches that can be beneficial in reducing the potential patient harm. And we'll take a look at these. So discussing the risks of opioid-related harms of the patient, maybe co-prescribing naloxone, definitely checking the PDMP. There's even the potential to consider toxicology testing if that might be helpful to know what other medications might be impacting the situation. Also, there's caution against co-prescribing of benzodiazepines. Hopefully people are really familiar with this by now, but interestingly, they felt it necessary to continue to put that in. And it is crucial. And then also, this is a big one, and it has to do with the relationship to the removal of the requirement for the X waiver to offer or arrange treatment for opioid use disorder. And at this point, prescribers can prescribe medications for opioid use disorder without an X waiver. All right, next slide, please. So at this point, we want to take a look at our toolkit. The guidelines are really helpful, and so hopefully you'll look at those. We put some additional links next to those recommendations to help out and further illuminate some of the things that you might do with those recommendations. But also, I think Yvonne's put the link in the chat for you. You can click on that link to pull up a copy of the toolkit, and we're going to take a look at some of the additional resources we've added to the toolkit to help you out. So next slide, please. So the first set of resources are really focused on the clinician. And there's lots of stuff there, but you'll find that there's some additional resources that the CDC has that are very helpful. There's some other pain management guidelines in case a clinician would like some different perspectives and some additional ways of thinking about pain management and opioids. And we have a copy of a link anyway to the Beers criteria in case that might be useful. And then there's SAMHSA's links to SAMHSA's information regarding the removal of the X waiver and some ways to obtain Narcan there in case people are looking for that to offer. Next slide, please. And then next slide. Yeah, thanks. And then at the bottom of that particular section, you'll notice that we put in some screening tools for opioid use disorder. This is important to know that these are screening tools. They're not to be used for diagnosis, but they are to help identify potential risks and maybe a need for additional assessment. Next slide, please. All right, and then we have another section on the toolkit that you can see where we have some patient education resources. We're hoping that these resources will help patients get a better understanding of pain management and how they might begin to discuss their treatment with their provider. We've also included some links to mitigation strategies, such as safe storage and disposal of medications, naloxone availability, fentanyl test strips and where those can be obtained, as well as the dangers of polysubstance use. And this can be really important to older adults, right? And so we want them to know that if they're taking other medications that might be contraindicated with opioids, hopefully they'll talk to their provider and ask questions about that. And at the very bottom of that patient resources section, you'll find there's a link to the Intermountain Healthcare page where there's a lot of additional patient education materials. We included that because what was nice there was that a lot of those resources are also available in Spanish versions for your patients. So those of you who have Spanish-speaking populations may find some Spanish language versions of resources that are helpful. Next slide, please. All right, so that's a quick overview for us of where we're going to be heading and some of the things that are in the toolkit. And now I'd like to introduce to you Dr. Rachel Dipple, who is helping us sort of do the rest of these sessions. And she has a wealth of experience to share, and she's going to be taking us through these recommendations in more depth in our future sessions. So Rachel, I'm going to let you tell people a little bit more about yourself and the upcoming sessions.
Certainly. Thank you, John. Good morning, rather. This is Rachel Dibble. I'm a nurse practitioner by trade. I have extensive experience in home health and palliative care, hospice, long-term care, quality management, and chronic disease management. And so the next 5 sessions are the actual toolkit, and the recommendations will be discussed in much more detail for the next 5 sessions. Next slide, please. So the future 30-minute sessions will cover the guidelines 1 through 12, July 25th, 2023, August 22nd, 2023, September 26th, 2023, October 24, 2023, and November 7, 2023. And here is the registration link. Please register for the sessions. I think they're extraordinarily important, particularly with the changes that the CDC has made, obviously as well dealing with the stigma of opioid disorders, as well as prescribing appropriately with some really tight guidelines to attempt to mitigate some of the overdose pandemic. It is a continuing session, so that's why I really urge to join all of them so you don't miss any of the guidelines. I'll say that I certainly learned a lot by putting this deck in order, and so I think it is really important as providers and people who have interactions with patients. And I thank you for coming to this introductory session. Next slide.
So we want to open it up now for any questions that folks might have, either about what we've talked about today or perhaps about how the future sessions will work. We've tried to make the sessions brief, 30-minute sessions so that it'll be easy for you to hopefully take a little bit of time, drop in, and learn a little bit more. So any questions today? Feel free to either put them in the chat or just open your mic and ask.
All right, I don't see anything coming through the chat.
Okay. So if you all take a look at the toolkit, you'll notice that there are links to the CDC guidelines there, and you can download a PDF of it. And being the person I am, I tend to download the PDF and go through it with a highlighter. So if that's something that that you might find helpful for yourself, it can be a really illuminating sort of experience to kind of take a look at some of those recommendations. No questions?
None in the chat.
So
All right,
we appreciate you. Yeah, Christine, if you go ahead, and we appreciate everybody coming today, and we look forward to seeing you in the future to look more deeply into these recommendations. Dr. Dibble has some great information. I've been talking with her a little bit, so she has some really great information that's going to help further take a look at how those recommendations can be used in your organization. So Christine, would you go ahead with the...
Yeah, just a couple more comments before we're done. On this slide, you'll see Superior Health Connect link, and I think Yvonne put that in the chat. If you haven't joined already, please do so. We use Connect as a platform to share information and continue conversations on a variety of healthcare topics. So this really does conclude our presentation. You'll also see a link in the chat to a brief survey. We would definitely appreciate your feedback on today's presentation. And you'll also see a link in the chat for today's slides. At this time, I just want to open it up if there are any final questions that anyone thought of. And really, as Rachel and John both stressed, invite you to join us for those next 5 sessions. Where Rachel will do a deeper dive into all 12 of those CDC recommendations. You're not going to want to miss it.
Yeah, let's. There is a link now in the chat for the slides handout. So in case you want to grab those, and that's something we will be providing at future sessions as well.
And feel free to invite other colleagues to join you on those sessions. The more the merrier.
Yeah, please spread the word. We're really trying to get this information out there so that we can reduce opioid harms and help sort of do our part for the opioid crisis.
Yvonne, are we seeing any questions? Does anybody
No.
want to come off mute with a question?
No questions, but I do have a question for them because I don't see that it's as a hyperlink. Is anyone able to click on the survey? I can try and download it one more time and see if I can see if did anyone answer?
No, let me see. I'll try it too, Yvonne, just to
Okay.
see.
Oh, that's the long version of it. It doesn't work. Okay. Well, I think this
Nope, the
last
short one doesn't work.
really long one I just put in, that should work.
Yep, that one works.
That one's working. Okay.
Yeah.
So please complete the survey just to give us an idea of how we're doing. Thank you.
Thanks for letting us know that, Stacy. Appreciate it.
Thanks.
All right, everyone. Thanks so much for your time today. We look forward to seeing you in the future, and please do come back so that we can all work together on this.
And I'm going to drop copies of the slides into the chat as well.
The link, Yvonne.
Yes.
Great. Okay. We wish you all a good day. Thank you again for joining us, and we'll see you next time.